So your code, put your code for your mentimeter.com or menti.com.
Someone listening in, did they get the Menti? Okay. If you have a cell phone, we're doing that activity on your cell phone. If not, you can share with the person next to you. So you're going to log on. Okay. Yes.
menti.com. If you type in mentimeter.com, it's still going to see the title of it. So your code in there is 3975. Tell my age, right?
3252. Teamwork.
All right. 3252. It's 3975 3252. Okay, so the question is what makes a good leader?
Okay, so the question you're going to answer is what makes a good leader. So there's 3 prompts, I believe. So for each prompt, you can put a different answer.
All right, so as you guys notice, as soon as you type in a word, what happens? It starts showing up on the iCloud. The more, I mean, again, just choose, right? So again, one of the goals of the iCloud is to see what are the similarities within the group, right? So, if you guys think about knowledge or inclusion, the word that's the largest is the word that's typed the most. All right, so we're going to keep going. Let's have fun with this. I see knowledge, tone. I like the word tone. You said tone. I like that. Good listener, positivity, supportive, understanding. Knowledge is still at the beginning. Yes, knowledge, tone, and supportive are out there. Strong. Communicator. What's that? That one was strong and inspiring. So let's keep going. You guys are inspiring. Patient.
Any other ones? So far, knowledge is still winning.
Perseverance. Put it in there. You guys notice how knowledge is kind of the 3 things, okay? Supportive is starting to meet up with knowledge. What you guys are thinking support is more important. Someone said smart. Smart is not really getting a listener. Excellent, excellent.
Action is getting smaller also.
Knowledge. So let's talk about this for a little bit, right? Okay, people listen. So as I said before, I love the word tone. I'm surprised to see tone there, but I absolutely love that. You want to tell us why? Why do you think tone is important for group leadership? Who did that? Anyone? All right, that person wants to be anonymous. That's fine.
I think tone is important for group leadership because you want to make sure not only the tone of your voice, but your demeanor, your mannerisms, your tone when you're presenting, it's engaging and that people want to hear what you have to say. If I was to stand up and say, in 2 minutes, I'd be lost. I lose my voice. You agree? Okay, so I'm going to try and keep this tone going so I can keep you engaged so that you're with me for the whole time. You're with us for the whole time.
My husband is a project manager for like hospitals and stuff like that. So he does a lot of management from different places, and I always, as a supervisor, think of his voice in my head. Super frustrated. That's when he's most patient. like I hate when he talks to me like that, because he's frustrated with me, but like when I'm being frustrated or when I'm dealing with like difficult aspects with people, I always like imagine like how serious. Listen. And it's like, you can tell he just like collects himself and he's like, listen, or not like that, and then have that very calm tone the entire time he's talking to somebody. You can tell like he is like that dad tone where like when they're quiet, they're angry, scarier than when they're like.
That's a great point, because it's not all the time he needs to be excited. Sometimes you do need to have that compassionate tone, that mild tone, that serious tone. So you have to be able to adjust and adapt it based on the situation.
If you read the room, right? Read the room. Know what is the atmosphere. Okay, so I guess so we'll talk a bit about Mentimeter. One of the main reasons why we started off with Mentimeter is that we wanted to give you one of the major goals, objectives of this session is to really leave you with some real world tools that you can use, particularly in your program. So we'll talk a bit more about Mentimeter in the meantime. I guess at this point in time, we should introduce ourselves. Give me a minute. I'm going to go to our slides. Go ahead, Carolyn.
I'm going to say our program. I'm going to add in teaching in schools. How do we engage our students, our adult students that are coming in? How do we keep it interactive? And when Tula tells you about who she is, you'll kind of see why this goes hand in hand. So again, I'm Carolyn. I am a certified recreational therapist for 20 plus years. I stopped counting after 20. Don't let my young face fool you. I've been in the field for a really long time. I've worked with a lot of different populations, mainly for the last 18 years, probably. I've been in long-term care. So I work with rehab, long-term care, adults, mostly. And now we're seeing a big transition where we have a lot of rehab and people that are younger coming into the nursing homes, into skilled facilities, whether for short-term or long-term because of placement. So I've definitely had an opportunity to work with a lot of different populations.
Hi, my name is Tula. At the core of who I am, I'm a CTRS, right? Carolyn and I met years ago when we were even parents, working at Brookdale Hospital, right? So at the core of who I am is CTRS. However, I love my CTRS experience, and I'm going to tell you that everywhere I go, I take my CTRS experience with me. Leadership of what I do. So what I did is I went ahead and I became a certified health educator, and I have an MPH. So currently I'm a full-time faculty at Montgomery College, Maryland. I coordinate their public health program, but we've been expanding our programs. I was sharing earlier on that one of the kind of major setback is that in Maryland, there's not a lot of programs that teach therapeutic realm. So my desire at some point in time, right now, is to probably, introduce the therapeutic recreation, because we do have a lot of opportunities, and I think a lot of opportunities will occur into the future. So although I still dabble in therapeutic rec whenever I get the opportunity. But although I'm not actively practicing as a CTRS, I utilize my experience in a multiple of ways. I'm actually working on my doctoral program. So a lot of what we're doing today is really combining adult learning principles into the TR program, right? Because when I first learned about adult learning, I was like, this is what I needed when I was on those groups working with different clients. I needed to understand, how do we re-engage the adults? How do we decided and how here today? I'm gonna take my mask off. So objectives. Okay, so our objectives are to challenge our assumptions of adult interest in therapeutic recreation activities, to define adult learning principles, refining and adapting activities for different settings, and to identify adult technology that can help enhance your group engagement. Okay, so we're going to look at this slide, and this is what, day 2 of
let me not use this. Let's use something else. But this is, we're all in a learning environment. We're sharing. Some people are speakers, some people are presenters. And when you think of the pictures here, I don't want you to say anything yet. And this is very interactive. We do need your engagement. We do need feedback. This works best when everyone participates. Now, looking at this, you have the one person thinking about the beach. I'm sorry, that would be me on any given day. I can think about it while I'm talking to you guys now. We have the people that are paying attention and smiling, which thankfully, that looks like all of you right now. I'm really happy and excited about that. And then we have the people that are kind of, you know, they're checking the inside of their eyelids for a little bit.
So that was on training, right? I don't know if how many of us have thoughts about ourselves. Again, I hope it's going to be fun. You're checking your time. Is it when it's going to be lunchtime? So one of the goals here with this whole concept of understanding how adult learners engage is really to kind of take out the boring, the monotonous training that we all have to engage. So one of our tools, we introduce you guys to Mentimeter. What do you guys think about that experience? What do you think about Mentimeter? You like it?
Has anybody used it before? Okay.
Create like a little bit. Or like my staff training, when they come in, as they come in, there's like a question, and you log in the password, and like it just starts growing as more people.
Do you want to use it for leading the group?
In the past, I was asking a question that they may not want to answer out loud, like, how are you feeling, kind of thing. And it was really.
And those are great tools. Like I envision using it with maybe subacute residents because all of them come in with their cell phones athletes. We're always looking for them. I think we'll miss it. But they always have their cell phones. So it's something that I think that we could definitely use with them that will help engage them and maybe help. We'll get to that part. But
Right. So one of the things I say is that COVID-19 has really, all of you all know in this room, but I think it has made us positive impacts on the way in which we do things. It's forced us to come out of our comfort zone and utilize much more technology. Because again, like the last session, we're talking about touch, and we all as therapy department know the importance of touch. But during COVID, we can't, right? So we needed to shift. And for many of us, we were willing to embrace technology, utilize it. And I know we're in the classroom, right? It was a challenge, like, on Zoom, like, hey, you you're muted. But how many of you guys see that on commercial, right? Or, so there are lots of on the key here, right? The one thing, if you don't remember anything we discussed, one of the things I want you to remember that there's lots of online tools in which you can engage your adult clients in a more creative, social distance way. I mean, how many of you guys have used a Google Doc? Right? Have you thought about using Google Doc with your clients? What would be the problem with using a Google Doc with clients? Not really. Most of our clients, they have computers, cell phones.
we also have laptops that we got through Google video calls and stuff. So we have not iPads that we can use and set it up on as well.
I mean, one of the things we can guarantee that 90%, not to mention maybe 75% of our clients, particularly the younger population, they have a cell phone, right? Most of them come in with an iPad or computer. There are lots of creative ways in which we can use these technologies. Like we had to in the middle of COVID. So that's what we're going to be talking about. Shifting the way in which we do things. But before we do that, it's really important for us to understand the adult learner, right? What do they need? So we're going to go through some adult principles. But before we do that, let's do this reflective exercise.
When you attended a training and you never looked at your watch, wondering when it's going to be over. Also, think of a time when you returned to your office and you thought to yourself, that was a great group, or that was a great meeting, that was a great experience, or that was a great class,
So anyone have an example? What what made that experience? What made you think that?
Okay, yeah.
I got good vibes.
Okay.
So I need to ask you at the end to see if you still, okay,
I should.
okay.
So we had like our very own modified version of the like and thing that's on my phone for was recording. I didn't hear when it ended, but I stayed over. If it just kept going because they were so engaged that they loved it. And it was the most fun I had since COVID even happened. So what do you think you do?
I'm so easy now.
I feel like it was more like their spirits were out and like cheering them on. And like they got to actually engage in something that wasn't like in room, like one-to-one activities. They were around, even if they were just always like moving.
Alright, so peer support, right? A motivation, all right? Those are all things that we need in a group, right? You want to feel supported. You want to be motivated. You think, some of you, your professors aren't, so you don't really fun. Think about that time when you walk into that class and you're like, you walk into that class and you're like, oh, I hope this semester's going to be a good semester. What was a good class for you? Many of all of us had gone to school at some point. Makes you feel important. It's not.
I feel like when a professor gives like personal experiences, like kind of like relate. Like
Not too much personal experience, right?
it's like something that oh, okay, like that in my life, like I could relate to this.
Right, relatedness, right, to the content, to their personal experiences. Yeah, I love that.
Professor takes feedback and examples.
Your voice is being heard, that professor is honoring what you say, right? They're acknowledging your efforts. Excellent, excellent. This is gonna be easy, Carolyn. Write a little tap out right now.
I think so. I like how you did this because you have, it was a good group, and then you have the facilitator. It's a relationship between the two, and you really nailed it on this slide. And what I really think is important tone is that you set that tone. So like we all came in here, you all set the tone. Like we knew it was gonna be exciting, we knew that you were friends, we knew, we knew some information about you all that makes it easier for us to do. I have jobs, I have HRs, and one of the HRs is like, hey, we're going to, and I can't stand it. So I just it's a whole thing. But then people want to come back and I think that I think like the groups that I felt the most like excited when I leave are the ones that, I have a couple different ways that we run groups. Like we have I'm sure everybody does too, a group that you show up and you go, okay, today we're gonna do arts and crafts, and everybody's like, great. And then you have another group who are like, okay, we're gonna do arts and crafts, anybody that wants to come, feel free. And then all those people that come aren't there because they want to do it. And those are the groups that are like, oh my God, that's so fun. Or like those, even just meetings of like, I'll have a meeting with certain people who are like really not that specific, and they're like, I'm like, oh, I'm so excited about this community day I'm gonna do. And I'm like, okay, good for you. And then I go like have a meeting with like the Parks and Rec committee. We're like, okay, this new like community event that we're doing. I'm like, yeah, let's do this. And let's go talk about that. And like, really, that's talk to the right people. Like, have the right, like, know your groups and what their interests are, so that when you present them to these, then they are enthusiastic. Even as enthusiastic as you want to be about arts and crafts, they'd be like,
always matter, you know, your tone, if they're not into it, and you just have to adjust. I know like arts and crafts, do like, there are types of arts and crafts that are different than just gluing pieces of paper together.
I think having, like a backup activity or even two in your back pocket is like really helpful. Because sometimes the first activity will like.
Well, I can definitely agree with that, and even with specific programs, because you know we follow what the Department of Health says, and we want to make sure that they look at our calendars and they want to see what we have prepared for the day. And if I say that I'm doing 50 music, they don't want to come in and see me doing dominoes. So you have to be able to work within that. I may be doing dominoes, but we're going to be doing dominoes with 50s music. So you have a little wordplay sometimes to keep the program titles still interesting, but still have that bag of tricks. I never walk into an activity or a program with more than 2 or 3 things in my head that I can do at the time. And that's really important because you may have the person that's 101, and you may have the 39-year-old that is there because they broke their leg and decides to come out there for the day. So that's really important as well.
So as we go through these slides, I want you to think of adult learning principles, just not from the perspective of what we do for the client. So learning, we're all adults, right? Even if you're supervising staff, you're supervising adult staff, right? And you're doing trainings with your adult staff. Your patients are adults. So we're going to go through some principles that is important to remember when you're creating trainings, you're interacting with your coworkers or the individuals that you're supervising or the individuals that you're leading the groups in. We'll talk a little bit more about the differences between educating kids and educating adults, because there is a difference. And I was like, hallelujah, when I found out or realized the difference. It took me a minute. Sorry, it did. All right, so we're going to just quick go through some definition of terms, right? So a facilitator, right? Giving you some source of information. So a facilitator, as we all know, is someone who helps a group of people understand their common objectives and assist them to plan to achieve them without taking a particular position in the discussion. One more time, especially that last part, that's important, right? A facilitator is someone who helps a group of people understand their common objectives, right? And assist them to plan to achieve them without taking a particular decision, right? So one of the things I like most about this slide is it kind of gives you a hierarchy of the roles of a facilitator when it comes to the group. You know, as a facilitator, you have a responsibility to create. And when I say facilitator, I'm using that in place of a group leader, right? Or maybe you're the person that's training, you're still facilitating, right? Maybe as an educator, you're still facilitating. As conference presenters, you're facilitating. And it's important in any group setting that we first create a safe environment, right? It is your responsibility to create a safe environment. Your environment also needs to be supportive, right? So everyone's voice has a place, right? You're honoring the word. Sometimes some people can be a little bit off, and maybe to respect the dignity and the rights of everybody else in the group, you may need to ask that person to be a little silent, because particularly when it comes to a lot of those political discussions, right? As a facilitator, you have a responsibility to make sure that your group is interactive, right? Interaction, right? You lead and mentor, be a small group, you participate, you partner with the adults, you make experience belonging, and ultimately, the goal is that you see better instances of engagement, right? You know, plan, reflect, and make choices. I really do like this particular slides, and remember, these slides will be made available to you guys after. So you have this, particularly when you're looking at safety, right? Safety and support. And it talks about psychological and emotional safety, knowing the difference between those, right? The program space and the furniture, right? That's important. Emergency procedures, healthy foods and drinks, physically safe environment. So we're gonna move on, yes. All right, so we're gonna go through some of the adult learning principles. And for some of you, this is not new information, I get it. But I thought it was pretty interesting. And I want you to think of it, although these adult learning principles relate more to education, I think it really does have a crossover to what we do as therapeutic practice. So andragogy, so there's a difference between teaching kids, that's pedagogy, right? Pedagogy, the science, the art of teaching children, but andragogy is the art and science of teaching adults. Because that's what we do on a daily basis. All adults, we're interacting with adults. Right? The following 6 slides are based on the work of Malcolm Knowles. He's one of the founder of the principle of andragogy, who is a highly influential in the field of adult education. So he focuses more on adult education. There's lots of seminal work done by Malcolm Knowles. He talks about the andragogy principles. And I think that this is really essential for us to understand what adult needs, right? And the key here, remember, is that the adult need is not different from yours, right? Everything that you need when you're going into training is what your clients need when they're right? They want it to be interactive, right? What you want is what they want. So they're not much different from us. What's different is your role, right? You may be the facilitator, but you need to understand what they need, what their needs are when it comes to your group or learning something new. So we're going to go through some 6 principles, and again, this is not exhaustive. We're looking at only 6 of his principles. And a lot of Malcolm Knowles' work in more recent years, they've added a bunch of additional adult learning principles. So we're just going to 6. If anyone wants more information, I can definitely send you some articles. There's one cited right there on the slide. That's a good reference. Again, one of the things I did in my students all the time, feel free to take a picture of my slide if you want to. All right, take those phones out, take a picture of the slide. Your phone is a tool, right? If you want to, that's fine with me. So need to know, what do we need? Adults need to know. We all need to know, right? Adults want to know why they need to learn something before undertaking the learning event, right? They want to know why, right? Why do I have to come out of my bed and go to school? And as a facilitator, you have a responsibility, or you must help the adult become aware of their need to know and make a case for the value of this activity. Right? Need to know. I'm going to some good examples.
Okay, so I think similarly to what sorry, can't remember it. Heather had mentioned before about the difference between the two. Saying, hey, I haven't, come on, let's go to arts and crafts versus who wants to go to arts and crafts is kind of like the beginning of it. And if you think about the things that you do in your daily lives, you have no one really just shows up for something without knowing what's going on. And it's a lot different from when you're a child and your parents says, hey, we're going here, and you go along. You want to know what's going to happen. You want to know who's going to be there. You want to know how long you're going to be there. You want to know what to expect when you get there. You want to know, especially in a time like this, after post-COVID, the things that I choose to do now, it's, well, is it going to be worth my while? Going out and maybe not having my mask on for a little while, the things you have to become more comfortable with. So you need to know these things. You know, as adults, we do need to know these things.
Adult, we do have a interactive activity at the end. You guys need to practice some of the things that we're doing, that we're doing when it comes to engaging the adults. All right, so learn a self-concept, right? Concept, self-esteem, who they are. Adults believe that they are responsible for their lives, right? How many of you guys don't believe well, most adults believe that they're responsible for their life. I should correct that. But those who say that adults need to know that they're responsible, right? They need to be seen and treated as capable and self-directed, right? Seen and capable and self-directed. Don't you guys like that? That independence, that autonomy. Like someone said, I give a person a choice. Do you want to do this? Right? Because you've given them a choice. Maybe to say same activity, but you allow them to choose. So you must respect that self-concept. So facilitators should create an environment where adults develop their latent self-directed learning skill, right? So your groups, or even the way in which you present it, you want to make sure you are honoring that concept of self, and self-esteem, respect, confidence, confidentiality, esteem goals, eliminate judgment. What is important to the person?
With this one, I think of the short-term person in a facility who is there, and most of the times, this is something that we're experiencing, I'm experiencing very, very, very rapidly. We're getting short-term residents, they come, they have their phone, they have their tablet, they have their connection to the outside world, and they don't want to associate with anything. And they don't even want to hear what therapeutic recreation is because they feel like there's no benefit to them. They would never know and understand what that is until they experience it. So how do we get them to transition over to that point? Is one of the things that we have to look at.
All right. So the role of the learner's experience. So let's go back to this before. Let's kind of talk about this. Sorry guys, I'm just gonna look at my slide transition. So factors that influence adult engagement. So the role of the learner's experience. So back to this whole concept of self, right? So they want to know, they want to be responsible for their lives. They want choices. They want to be self-directed. So that is important when it comes to the role of the learner's experience. As therapeutic rec, I mean, for the most part, we're creating an experience, right? Adults come to an activity with different experiences. They're bringing in experiences, but we're also giving them experiences. There are individual differences in their background, their learning style, motivation, their needs, their interests, their goals, creating a greater need for individualization of teaching and learning strategies. In education, at least for me, I utilize this. This is really important that you recognize that everyone brings some learning experience. There's prior knowledge that it's really important for you to build on, and that's important even in your group. So you want to, and with this prior knowledge, you also want to recognize unconscious biases that may exist in individuals, right? Now, I know there's another session that's talking about cultural competency, how important it is for us to be culturally competent. Part of being culturally competent is recognizing unconscious biases. Now, one of the things I say to people, they look into it, I say that everyone has a bias, all have a bias. Some of them are known to us, it's unknown. And I think as professionals, particularly therapeutic rec, it's important for us to understand where we are. There are some clients that I just have a hard time engaging with, but they're in my group. And I need to recognize that. So to make sure that I am aware of my own personal unconscious bias, and I'm not bringing it to the learning environment. I'm not bringing it to the activity. So the richest source of learning resides in the adult itself. Here we're tapping into the experiences through experimental techniques such as discussion, problem-solving activity, or case activity. So facilitators need to be aware of personal biases and assumptions. Bring this to learn, okay? All right, so another adult learning engagement principle according to Malcolm Knowles is adult, you need to know when adults is ready to learn, a readiness to learn. Their readiness to learn is important. Adults become ready to learn things they need to know and do it in order to cope with real life situations, right? Adults want to know what they can apply in the present, making training focus on the future that does not rely on their current situation or less effectiveness. So we need to really understand a person's motivation, their readiness to be a part of our program. And I think this is really important to a lot of the summer youth, younger clients, right?
So this slide
Casey to do something. This is probably the last scenario I'll go share. I want you guys to think of some scenarios that you have as we come up to the different engagements. So with readiness to learn and the motivation and the things that tie in to get the adult learners to want to participate and be eager to learn. I think of a resident that I had, and it took us so long to get this man out of his room because he's a paraplegic. And I can't remember how he got to this point, but he's a young resident. He's one of our residents that are under the age of 55, and he's a paraplegic, and he was just very discouraged. He didn't want to do anything, and we got him involved in a group project over the holidays. And this man saw me one day, and I was going around and I was taking pictures. Asked, "Do you mind if I take a picture of you?" Because it was for the project that we were doing. I took a picture of him, and he says, "Can you please take a picture on my phone?" So I said, "Absolutely." So I took his phone out, I took a picture of him. He said, "Well, I want to send it to my family." And I said, "Okay." Sent it to his family. I saw him periodically coming out of the room more and engaging more and engaging more. And then a few weeks ago, during rounds, I said, "We'll see how they're doing." And I knocked on his door and he said to me, he said, "I want to tell you something." And he got really emotional. He said, "You changed my life." I said, "How did I change your life?" He said, "The picture that you took of me that I sent to my family showed them that I'm still a person and I'm still alive." And because of that, they started to come to visit. And now I'm motivated to do so much more. So I can't wait till they come back so I can show them this and I can show them that. Because I saw a turnaround. I saw that he started coming and he started doing, it involved that I'm not going to say had I not been taking pictures that day, it would change, but the whole instance of it. And I had said to him, when he said, "We can send it to my family," I saw his face light up and I even said to him, "Anytime you want me to take a picture, we can share, especially if it's on their phone, because that's their thing. It's not the pictures that I'm sending. I didn't have to have a media release. He can send it to whoever he wants to on his personal phone." And it was like the best thing ever. And this shows how he went from being that person that probably felt he didn't belong or he had this loss of identity into the next level.
Right, one of the things I would add in terms of readiness is particularly those short-term rehab patients, I work in a substance unit, all our staff, right? Sometimes it feels like there's no activities that you thought they're not ready. It's okay to not be ready to engage in activities. However, as TRs, I really think it's important for us to really start utilizing a lot of these online interactive tools. So they may not want to come to your group, but there's so much independent. I mean, Mentimeter, like Jill and I will talk about a bit more after. It's not just an the activity engagement in iCloud. There are trivias that you can do. You can send. It's going to take a little work in the beginning, but once you have those documents set up, you can just send it to patients. You can send patients trivia activity on Google Drive and you share. You don't even have to see them. You can see when they've worked on that Google Drive. As I said in the beginning of the session, I live in Maryland, Carolyn in New York. We've been working on our slides using Google Drive. Sorry, I can't say the word right now. We've been working on the slides that way. Even last night, Carolyn was like, "I love this." I was looking at it. I was making this changing. Something is changing. I don't know I'm changing it. Right.
So I'm learning about it as well.
So these technologies in your program. One of the things I will say is that I'm sure a lot of people are going to agree with me that, not just COVID, but we were expecting this larger proportion of our population to be over the age of 65. Now we don't know because COVID has really impacted older adults when it comes to, the population size in terms of those who are over 65 and over. They haven't really done all of their final populations yet. But the older population that is coming into our community day program, they're much more astute, they're much more knowledgeable, they're much more oriented towards technology. So you handing them, but first of all, let's not kill people, right? Let's just use online tools and save the trees right? They're much more knowledgeable, so we need to step our game up. Use technology in your program. Like, you copy, you just send it a link. But then you come here on a different link, right? Can you guys see it? Can you all see it? All right, so adult learners, orientation to learn. Adults are life-centered, right? We are task-centered, problem solvers, or problem-centered in their orientation to learn, right? So we want to get the task done. You know, you guys are here today, you want to get those CUs and get on. I'm thinking about my drive back, right? We're problem solvers, right? We love to solve problems. We love to come up with solutions. I like to say also we're social beings, we're social learners. We learn, many of us, even people who don't think they do, but many of us learn better in a social situation, right? Talk about that support, right? Even people who don't think they do, you know, if you put them in a group and you force them to kind of engage. All right, so adults are life-centered, problem solvers. In their orientation to learn, they want to learn what will help them perform tasks or deal with problems they confront in everyday situations than those presented in the context of application to real life, right? We don't want a lot of time. Anything that we do, we want it to mean something. We don't want to waste our time. So for particularly those adults who may not want to join in practice, we got to think of more cognitively stimulating ways to engage them, right? All right, motivation. So adults are responsive to some external motivators, but most hopeful motivators are the internal motivators. So we're responsive to external. So internal includes the desire to increase job satisfaction, self-esteem. Some of our clients, they're motivated by getting out of there, right? So they want to do whatever it takes for them to leave. Motivation can be blocked by training and education that ignores adult learning principles.
Okay. I want you to think about these 6 factors because we're going to do an activity at the end, and I want you to use the 6 factors to help you with the activity.
This internal motivation and that internal drive, right? All of you guys have a reason why you're here, why you're in school, reason why you're advancing. That internal motivation is really important. Okay, I love this little graphic here where talks about internal and external. The internal, identify the needs to hold yourself at the highest standard, right? And that creates a combination of the internal and external is that drive. Right? This is kind of where my research is. I'm talking about self-concept, drive. And again, as a TR, you see the patients come into your facility and the ones who are really motivated, they're like, I'm doing everything because I am here. You see that those are have a longer life expectancy, less visits to the hospital. All right, so I'm going to give you some practical examples, talk a bit about the small groups, right? Small group setting, so adult participation equals that shared experience. We're talking really about your group experience. They teach others other concepts in new ways. So we talk a bit about peer support, engaging individuals in a small group setting. You know, to enhance safety, we want to reduce fear of judgment. You know, again, honor the voice. Whether online or in classroom or in a collaborative learning setting or environment, we want to make sure there's safe exchange of information, engaging your adults. All right, real world application, adults must see value, right? Your program, you must provide value. And you as a facilitator need to determine what that value looks like. If they can see how it applies to them, the adult learner will be more willing to engage in new learning. Application to real world must be clear. You're learning this because you could do this such and such, right? Knowing the reason for the task gives adult participants a sense of purpose, right?
So, and if you have a really quick example of what are some real world applications
To the activities that you do, that you probably share with your clients.
This is hard. It is hard. It's hard to think along those ways because we're so accustomed to just doing what we've learned or going. So for the new students coming into the field, you guys are kind of at an advantage because you have all these things that are being changed. People who've been in the field for a while, we're re-engaging the way and our thought process to adapt to the changes that's going on.
I think visual application is key. The value of what your program is. So as you guys create your program, you want to think about how do I make this more engaging for my client? For some of us, it may say that we have to go back and not do things the same way, to do a little differently. COVID has forced us to do things differently. Right? It's challenged us to do things differently. We can't go back. How to just go forward, right? Like using a lot of technology, using a lot of feedback. We just don't know what's going to happen, right? We just don't know. I mean, every couple of months we're hearing about a new variant, right? I don't like you, but I'm tired. I'm going to do that, right? But we just don't know. So we always have to anticipate at some point in time that we may come out to, like I told you, so I got my TR. When I went back to school to get my master's in public health, I remember my instructors telling us that there was a prediction that it would be a global pandemic, right? Looking at pandemics. Really? I mean, when COVID-19 hit and I actually saw people walking around the class, I have to say that I was really more. Again, we just don't know. So we have to change the way we think. So this, I love this. And this again is based on another adult learning theory or principle. And this is the 70-30 rule. I love this. I try to remember this. I can talk. The 70-30 rule says, and this is what the rule says, lecture-based learning, I would say lecture or discussion-based learning is the oldest and most common method of teaching, yet it is the least effective. Studies have shown that students retain only about 5% of lecture. Right? 70-30 rule says that to be more effective in our instruction, group leading, students, your residents should talk about 70% of the time, and the instructor speaks about 30%. And the instructor speaks for about 30% of the time. The 30-70 rule can be achieved by using process, comprehension, questioning, which we'll explain in the next slide. So that's what we're going to do our group activity. So what do y'all think about this? You should be talking 70% of the time. How many percentage of the time do you think you're talking? If you have a group and you're the only one talking, whose group is that? That's your group. They're not participating. There's no engagement. Right? Right. So I mean, 70-30 rule, I like the principle. I'm not saying it's a hard, fast 70-30, but I'm just saying that you should be reevaluating your group. If you're doing most of the talking, it's not really a group talking. You want to get, and there are ways in which you can get your clients more engaged. You get them asking more questions. Okay. Sorry. So process learning, process comprehensive questioning. This is not new. I'm sure you all have learned this in school. Basically, it's just saying we need to encourage open-ended questioning, and we're going to do some practice. We have time for that. Just the activity. Okay. So open-ended questioning, basically what it is asking questions where you get your participants to respond. So it says here, effective instructor avoids yes/no questions because they do not assess comprehension. So not getting. So you're going to actually practice this process comprehension question. So examples of process comprehension question or an open-ended question that you might ask in a group interview. During the initial interview, can anyone think of any examples? Any examples of open-ended questions?
What did they want out of the program?
That's a good one. Anyone else? All right, we're going to give you some scenarios. So it's your turn, right? Carolyn's gonna read out, we're gonna divide people into groups. You wanna tell me that?
Yeah, I think we'll just do 2, maybe 3 small groups, and it's 35 minutes. You're gonna go through really quick, and you're gonna come up with some open-ended questions to help this scenario. And your questions should include the why, the who, the how, and the where. Based on just keeping in mind things that we talked about, the principles that we want to apply to adult learning. So come in and say, hi, how are you? May not be a question that you want to ask, but most people just say fine. And then that's the end. Then where do you go from there? So you really want to think about the questions that you ask for these scenarios.
All right, so you read them out, we're gonna divide into groups. This one. This one.
So just you decide to get into your groups.
So you're gonna come up with 1, 2, 3, 4 process comprehension questions.
So you should have about 5. At least 5 in each group.
All right, so this is a scenario that we don't have a whole bunch of time. I'm sorry, everyone.
Okay, so the scenario is Joseph is a 64-year-old truck driver. He has always been a loner and is a functional alcoholic. His best friend is his dog. He was admitted to the hospital with liver failure and is now mandated to a rehab program because his company feels that he's not going to be allowed to work because they know about his drinking problem. He's not going to be allowed to go back to work because of his drinking problem. So while in rehab, he's doing physical rehab, and he also is a part of alcoholic rehab program. Joseph attends physical rehab, but he refuses to pay attention to any time and any portion of the alcoholic rehab section of it, which includes his rec therapist who comes to do programs with him. Going through this, think about things that you would ask and engage Joseph to understand, using the principles that we use, why this is important. Keeping in mind that Joseph has now learned that if he doesn't attend the second portion of the program, his job is not going to let him come back to work. So he needs that, some of the things we talked about. I want to say one, the motivation. What are some of the things that when you go into him and you explain to him what we're going to do, come up with the questions on the who, the how, the why, and the where to ask Joseph to help with his engaging the process. Do we understand?
A lot of instruction. So you're doing it with questions. We're gonna find out Joseph's why, Joseph's who, and Joseph's how, where. Again, you don't have to do all 4, but the key here is practicing open-ended questions.
Try at least 2.
Right? What open-ended questions do you have? Find out his why. Because the goal of the question is to create discussion, right? So perhaps
Motivation. What do you love about your job that you're really excited about? So it's hard to like just establish like that. So idea in your head, you know, this is literally
what do you like about it?
but you're
It is not a why, but why, what has the drinking done to your life?
not like
And then, what's the drinking done to your life?
Like what if they don't love their job? So whatever that is, like going on the road and listening to music and having like some kind of music. Listening to around the road. And then like even finding those music things like brings back to our sessions and like or finding music that's related to recovery, you know, something like that, where it's like, we want to find just share at least one of their questions. So I just think that's what it is. Or, you know, if they need a dog or they need some other type of engagement. Allison, why is that? think that would be my first question, is what do you know about your child? That would be really a basic about, you know, getting to know the person, what they really like, is it music, is it being alone, or, and then what don't you like about your child?
Okay, 30 seconds.
Oh, it was so much time. You want to go ahead? I know you guys, I know that was not enough time. I apologize. Again, talking about what adult learners need, right? We apologize, but we didn't anticipate the time correctly. Do you guys want to share? Anyone wants to share? You guys have a lot of conversation in the front here.
Well, one of the things that she has mentioned was like, well, I didn't want to go to the program, but I kind of flipped it to more of a positive, like, well, what are you excited about to return to work? What is your passion? Why do you like that? And what about your job? Might get some more insight onto why they started doing their lonely, or why do they like their job? Do they like music? And that conversation to really build on their motivation and what's
Open questions.
You want to share your question?
What is that person supposed to gain?
Okay. So what do they hope to gain? That's really important. That's really important. And then you can work from there to assist them to where their next step is. Thank you. And over here.
How has drinking
How is drinking alter your life and relationships? Which is really good also, because you think maybe there's a reason he's a loner.
And I think it's a lot of the initial assessments, we're just asking questions. It's so beneficial to build relationships with the patients. And that's one of the things I like about the process comprehension questioning. It may take a little bit more planning in the beginning, but just being able to ask questions that facilitate conversation with the clients to build relationships is really important. And they take a little practice, right? Not something that
It's not the easiest when you say it.
And I could just hear him inside, like, the next question is, well, why don't you want to go to this? Like, I'm bored. I don't need to do that. Or how did they alter your life? Like, nothing. Like, that's great. You always have to be prepared for those. Like, they don't see the issue.
Right.
So you ask questions on, like, issues. You're like, I'm fine. Why am I even here? Like, I obviously don't need this.
And I wanted to make sure I leave you, I got you over time. I wanted to make sure I leave you all with some resources, right? Engage in online options and do lots of fun options. NTV, there's great trivia questions, interactive, and it's not just for your staff, right? Kahoot, I love me some Kahoot. Let me tell you, especially when I could kind of put a little pseudonym in there, and my pseudonym is Super P, right? That's what I think I am in my head. The Kahoot is really great, right? Again, lots of you all have screens. You just get your little adapters. Trivia crack. Who loves trivia crack? Do you use trivia crack with your clients? Why not? I like the fact that it comes in multiple languages. Why don't you use that for clients? I mean, and all of these, there's a free option, right? They're always a free option, right? And even with the paid option, it's unlimited, so it can share between multiple staff. Google Docs, right? Lots of options in Google Docs, particularly for those young clients who are on their computers. You send them trivia questions, you kind of track their progress away from having to go into your. So thank you all very much.